Hypertension while pregnant or postpartum can increase the risk of other complications that impact the mom and baby. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. The Center for Disease Control and Prevention's Million Hearts named the Missouri Hospital Association a 2021 Hypertension Control Exemplar for its efforts to prioritize hypertension control among pregnant and postpartum patients during the COVID-19 pandemic. Aisha Syeda, Senior Program Manager of AHA Strategic Initiatives, explores the how as she speaks with Judy Hannan, Senior Advisor of the CDC's Million Hearts Initiative, Alison Williams, Vice President of Clinical Quality Improvement at Missouri Hospital Association, and Kendell Farr, Women's Health Nurse Practitioner at Hannibal Regional Healthcare System.
Thank you, Tom. Welcome, Judy, Alison, and Kendell, and thank you for speaking with me today. Judy, can you give our listeners some background information on the Million Hearts 2027 initiative and the 2021 Hypertension Control Exemplars Recognition Program?
I'd be happy to, and thank you very much for the opportunity to talk with your members about Million Hearts. Million Hearts 2027 is a national initiative co-led by CDC, Centers for Disease Control and Prevention, and the Center for Medicare and Medicaid Services to prevent 1 million heart attacks, strokes, and other cardiovascular events in the next 5 years. The initiative describes national goals that, if met, would lead to preventing 1 million cardiovascular events. In Million Hearts, we are always on the lookout for partners that share our goals. We facilitate collaboration, and most importantly, we promote implementation of key evidence-based strategies that we believe can drive preventing events, with a special focus on cardiovascular health inequities that need to be addressed. During the disruptions in care attributed to COVID-19 pandemic, Million Hearts initiated the Hypertension Control Exemplars Recognition Program to identify and celebrate the work of healthcare practices and supporting healthcare organizations that demonstrated excellence in prioritizing and improving hypertension control during the pandemic. Last year, we recognized a total of 8 hypertension control exemplars to acknowledge their dedication and ingenuity in addressing patients' blood pressure needs, to celebrate the impact they had on blood pressure outcomes, and demonstrate what unique hypertension management strategies are possible during a public health emergency. One of these exemplars was the Missouri Hospital Association.
Thank you, Judy, for sharing that information. And as you described, we know that with the COVID-19 pandemic, many hospitals had to start taking care of their patients while they remained at home. And we also know that uncontrolled and unmonitored hypertension among pregnant and postpartum patients can lead to some high-risk complications. So, Alison, how did Missouri Hospital Association help new and expecting mothers manage their hypertension during this pandemic?
Sure. Thank you, Aisha, again, for the chance to be a part of this podcast as well. Missouri Hospital Association was fortunate to receive funding from Missouri Foundation for Health through their COVID-19 emergency fund to support the distribution of approximately 3,000 cuff kits throughout the state. We heard about the Preeclampsia Foundation's The Cuff Kits program through one of our Missouri Maternal Child Learning and Action Network members, Sue Kendell, and were able to develop an efficient process of ordering and distribution with them. MHA and the MC Land saw the need for increased in-home monitoring options during the pandemic, especially when traditional prenatal and postpartum visit patterns were altered to avoid transmission. This meant that many vulnerable at-risk populations, whom already often experienced various types of healthcare access issues, were now at even greater risk for lagging care and necessary intervention. We knew health outcomes for both moms and babies could suffer. Being able to provide some support for in-home blood pressure monitoring helped engage and empower patients in their own health care, especially during a time when life and being pregnant was scary and seemingly out of their control.
What was the process of getting those blood pressure monitoring kits? Kendell, can you describe from Hannibal Regional's perspective, and then Alison from Missouri Hospital Association's perspective?
So we had an application process that was online. Our labor and delivery director had came across it and asked our OBGYN providers if they were interested. And it was very simple. I just filled it out and I heard back pretty quickly that we were accepted for the blood pressure cuffs.
Any thoughts from MHA?
Sure. So we partnered again with Preeclampsia Foundation to develop a brief online application for interested organizations such as Kendell's at Hannibal Regional. Recipients were clinical or home visiting providers serving vulnerable at risk patients who would benefit from increased blood pressure monitoring. Recipients also needed to attest to having some type of telehealth services so that remote monitoring and patient access were available and leveraged to support in home assessment, monitoring, and intervention. MHA then processed the applications and managed the ordering and invoicing for applicants through our partnership with Preeclampsia Foundation, who then shipped the kits directly to the recipients for distribution.
What outcomes or improvements have you seen at Hannibal Regional Healthcare System since making those blood pressure monitoring kits available to your patients? Kendell?
Most of our patients live in rural areas. Some of them live an hour or more away from the clinic. It made it nice. So they had a reliable blood pressure cuff at home. We knew the readings were mostly accurate because we taught them how to use it before they went home instead of them saying that they used their neighbor's blood pressure cuff or their grandma's that could have been 30 years old. We were able to distinguish between just a white coat syndrome when they were here and true hypertension. The patients felt more comfortable at home because they knew what symptoms to watch for and when to check their blood pressure. Because not only did it come with the cuff, but it came with a paper they could chart their blood pressures on, and then another form that showed the symptoms of preeclampsia and what to watch for. And it was color coded. It was very easy for them to read and understand. So if it was midnight and they had a terrible headache, they knew that they should check their blood pressure and then call the on-call physician instead of, maybe just going back to sleep after taking some Tylenol. We were able to provide them to at-risk patients who could not afford a cuff or would not have been able to buy one on their own. And we also did give out a few postpartum to patients who developed high blood pressure in labor and were started on antihypertensive medication in the hospital. So we were really happy with them. We are very thankful that we had them, and we saw a huge improvement in our patients, just overall satisfaction.
And this sounds amazing because you gave them the instructions, you gave them the education, and they were able to use it. So it was accessible and easily understandable for all of your patients. How many patients received the cuffs?
We received 50 blood pressure cuffs. Probably could have done more, but I think at the time when we asked how many we wanted, I honestly wasn't sure. But when you really look at how many patients are high risk, there's really quite a few. And we have about 50% of our patients are on Medicaid. So, I mean, that's quite a few. And they liked doing the telehealth because they liked seeing me and being able to show me like through the telehealth, is that on my arm, right? So it was good. I liked it. It was a good experience for me and the patient.
Great. And what was the overall impact of this collaboration, Alison, from MHA's perspective?
We just felt that these types of programs can really help to close a gap on care access and timely life-saving interventions, especially during a pandemic. We also heard from patients themselves that they liked the option of in-home monitoring and telehealth, especially during the pandemic. They felt safer. They didn't have to navigate many common access issues as much, and they were able to identify when they had a blood pressure issue that needed medical care, as Kendell just described. We also heard from providers that having cuff kits on hand and readily available to give to patients in the moment was critical. From this work, we are advocating for home monitoring cuff kits to be a standard in the global pregnancy visit payment rate and provided universally to all pregnant patients. We also learned the value of continuing to promote in-home blood pressure checks as part of ongoing postpartum care and through 1 year post-birth. We know from maternal mortality reviews that most women in Missouri who die of a perinatal-related cardiovascular disorder do so between day 43 and 365 post-birth. The availability and frequency of postpartum medical care is few and far between during this time period, and more work needs to be done to identify best practices for birthing persons through 1 year post-birth.
Thank you. So moving forward, how do we as practitioners continue to prioritize hypertension control among pregnant and postpartum patients, especially for those with low resources and high-risk complications? Alison, do you want to go first?
Sure, Aisha, I can start. I guess twofold. One is obviously the provision of home blood pressure monitoring resources. So being able to have that in their hands is really important. But the other piece that I would speak to is the need to make sure that patients and their family members have a really strong understanding and receive good education. As Kendell was describing, are they taking their blood pressure appropriately to begin with? Is it a good reading? And then how are they tracking that and what signs and symptoms should they report? And that's not important, again, just during their pregnancy, but also through 1 year postpartum, as we saw during some of our perinatal mortality review board results. As part of this work and continuing to prioritize hypertension control, we're really excited at Missouri Hospital Association and for our members across the state that we are finalizing the final pieces around receiving additional grant funding that will give us the opportunity to provide approximately 5,000 additional cuff kits in the next coming year. So we'll be able to hopefully further impact at-risk patients who would benefit from in-home blood pressure monitoring services.
Kendell, any thoughts?
I agree with everything that she said. It is very important for them to be taking their blood pressure appropriately and know the signs and symptoms to watch for.
That's amazing. And I'm excited that MHA is opening up that opportunity for other hospitals to acquire these kits for their patients. So thank you. And I'm excited. Congratulations on that grant. Judy, do you have any final thoughts from CDC's Million Hearts perspective?
Thank you, Aisha. A few. And first is just applause for what the Missouri Hospital Association was able to do and will continue to do to be able to put cuffs in the hands of those that need it and hopefully prevent some events in the maternal population. I'm excited to let people know that Million Hearts 2027 has established a new focus on improving health outcomes for pregnant and postpartum women with hypertension. The strategies that we outline that would drive improvement include championing widespread use of self-measured blood pressure monitoring, like you just heard today, expanding Medicaid to include coverage for the devices, medications, and extending the coverage to 1 year postpartum. Again, you heard how important it is from a mortality standpoint for that continued monitoring through the first year. And we also really need to be supporting opportunities to close care gaps when women transition from OBGYN care to primary care. And finally, it's also really important to promote aspirin use to prevent preeclampsia. You can learn more about strategies on the Million Hearts Initiative by looking at millionhearts.hhs.gov.
Thank you, Judy, Alison, and Kendell for sharing your invaluable insights with our listeners. And to our listeners, thank you for joining in.